Hi, this is Kitty Anderson. I'm a board certified menopause coach working to help women recover from menopause. It can be crippling, it can be traumatic, it can be devastating. You can lose your job. It is not a funny thing, and no one around us really understands us as we're going through this. We often think this is a temporary issue, but really, symptoms can last 15 years. And when you look at the 120 functions of hormones, you've got to wonder, how are we supposed to live without this hormone support? It just doesn't make any sense to me. And some doctors, you'll see them say, you have a choice to use HRT. And for me, I'm like, wow, we have bioidentical molecules, and I'm running at 125th of what I used to run at. I would like to be premenopausal again. So I have done HRT for 14 years, and I'm 64 years old and very happy with my HRT experience. So much so that I became an expert in HRT, and I'm here to help you recover 100%. We want to get you back to work. We want to get you back to your life. We want to get you back to a stable mood. We want to get you into shape so that you can prevent arthritis and some of the things of old age. We're still aging, so that's still happening. So, but at the same time, a lot of those aging elements are kicked off by low hormones. So we fix that with high dose HRT products, estradiol, transdermal, testosterone, transdermal, and usually micronized progesterone will work. So I also provide one-on-one coaching. But one of the other things I provide that I wanted to talk about today is ebooks. This is one of my ebooks. And so this video kind of goes with the video on endorphins and low dose naltrexone. So endorphins, you know, endorphins from exercise. It's a post-exercise experience. It's where the runner's high comes from. You know it from massage. If you've ever had a really full body relaxing massage, you have had an endorphin boost. It comes from acupuncture. It has that type of pain relief as part of what endorphins do. So I am considering low dose naltrexone, which boosts your own endorphins, as a non toxic menopause treatment that really isn't talked about. And the reason it's not talked about is because it is generic. There is no pharmaceutical company making a lot of money on this. You can make it for as little as $5 a month. You can get, I'll explain a little bit about how you can do that for $5 a month, or you can get it compounded for about $30 a month, somewhere between 20 and $30 a month. So it's a very inexpensive, full body anti-inflammatory that is non-toxic. It does not disrupt your digestion. It's an oral pill that does not hurt your absorption of other nutrients. It has many, many functions, but my ebook, I want to talk about this. So you can email me at jumpstartaip@gmail.com, and I provide many ebooks. One of them is on low dose naltrexone. And it has a special section in here about COVID-19 and how they're using it in a clinical trial for COVID-19. So once you get into the hospital, they're testing this out because they know how powerful endorphins are for your immune system. So this will summarize lots and lots of research on low dose naltrexone. It is a drug that has been around since the 70s, and it is effective for the following things: pain relief, fatigue, memory loss, weight loss, tissue healing, hormone balance. So we're talking about HRT to add hormones, still needs to be balanced. So this is a balancing mechanism. It improves your sleep. It resolves mood issues, and it reduces whole body inflammation, including brain inflammation. So I think we're going to find it's going to have a lot of brain impacts, and people do notice their mood boost, which comes from the brain, right? So people notice that. And they also noticed the enhanced sleep, which most of that chemistry is in the brain. So this is really a brain enhancer, and I would imagine it's going to be an Alzheimer's preventer, right? Because inflammation is in your brain as well as your body. If you have a chronic disease, you have some inflammation, and that is impacting your brain. So you want to protect it, use low-dose naltrexone as one of your treatments. I include in here, this entire table is all the summaries of the different kinds of research, even on cataracts, on the eyes, cornea healing in diabetes, dry eyes, resolving dry eyes, pain management, fibromyalgia, Crohn's disease, smoking, weight loss, autism, type 2 diabetes, depression, anxiety, cancer. This is anti-cancer. Anything that boosts your immune system is anti-cancer, anti-infection, including COVID-19, and anti-autoimmune. So we're using this across the spectrum. So you can use this ebook to learn more. Dr. Eon Zagon. So he is the top researcher. He has been researching this for over 30 years. And there's a link to his website here so that you can go learn more about Dr. Zagon. Then I'm including links to 2 Facebook groups where it's full of tens of thousands of people using this. And you can use the search bar on that page to hunt down your situation, right? So whatever you're looking for, you can do a search and find other people who have your situation and have used low-dose naltrexone. It also talks about the LDN book. So this is the best book to just hand to your doctor. You don't have to read it. It's hysterical. It is interesting, and it's got a different chapter for different types of situations or conditions. But I have just handed this to so many doctors, probably 6 different doctor types have all prescribed me low-dose naltrexone. Here's all the excerpt from the Stanford Pain Clinic. So what's really important about this, to show your doctor this, is to say Stanford is using this. And part of Stanford's excerpt is saying there is no known abuse potential. This is non-addictive. This is not going to hurt you. It's not something that you use and then have to use forever. People take a holiday from it. It is non-toxic. Then I talk a little bit about compounding if you want to get into the compounding aspects of things. And I recommend one compounder, which I'm not affiliated with. It's just has, when you shop around, right? You want the least expensive because it's basically all the same. Then I have an entire section on low-dose naltrexone for COVID-19. So this is talking about why they're using it in clinical trials for COVID. So this is after you get into the hospital. They're going to get you COVID-19. I consider it immune strengthening from all the research. And so really there's a prevention aspect here. So you have to consider that. Then at the very end, I'm linking to hundreds of videos for testimonials, right? So you want to know, will this really work? Is this worth your investment? So that's the bonus, the LDN research book that I'm sharing with you. And just email me, jumpstartaip@gmail.com, and I'll send it out. Good luck.